what is the opportunity to save more lives? So addressing the fear part, you read that or you hear that and you think, oh wow, there are lots of risks and only some super specialized PICU doc or PGM doc, by the way, both of whom you have on the podcast now,
Yes.
would even themselves be so cautious and hesitant about this. And that's not actually true. I don't know and don't think there are additional risks in children receiving transfusion compared to adults. A child in hemorrhagic shock, what do they need? They need blood. We're not asking ourselves, is this risky? Should I be giving whole blood? Should I be giving blood at all? We're saying this child needs blood now, we're going to give it. Why then wouldn't we, understanding that children with compensated shock who become decompensated, meaning hypotensive, are at high risk of dying in the subsequent minutes, why would we not push that therapy further out into the field and address that hemorrhagic shock as early as possible before the child gets a lot sicker?
And then also for the safety one, American Surgeon 2023, Don Jenkins, Josh Hazelton, and others are on this paper as well. And they had here, see how many patients, 90 patients. And the purpose of this paper was that whole blood is safe in pediatric patients. To quote, our data suggest whole blood resuscitation is safe when compared to component therapy resuscitation in the care of critically injured pediatric trauma patients. And then I've gotten permission to talk about this. This is a paper from Brian Eastridge and Don Jenkins, etc. And it's called Timing Matters, Pre-Hospital versus On-Arrival Whole Blood Transfusion in Pediatric Trauma Patients. And their conclusion was that pre-hospital whole blood transfusion produced more unexpected survivors, I love that term, and improved shock physiology in pediatric trauma patients suffering from hemorrhagic shock. We suggest that whole blood provides safe, rapid hemostatic resuscitation to pediatric trauma patients, and the earlier they get it, the better. So I still haven't found a paper that says the opposite, Mike. So I'm still looking for that.